Okay, welcome everybody. Hello, my name is Peter Gerlach. I'm adjunct assistant professor at the University of Iowa in the International Studies Department, and I serve as a board member for the Refugee and Immigrant Association. Thank you all for joining us today for this really important conversation. We're glad to have all of you who might join us live at some point, and we look forward to sharing the recording of this conversation with you later. As an introduction to the webinar and some technical issues, our format today is a panel discussion and our platform is Zoom. So some quick housekeeping matters. We do ask that if people join the conversation, that they turn off their camera and audio, which you can do with the icons at the bottom of the screen. This will help ensure that there's no disruption of the conversation. If you do have questions, you can click chat at the bottom bar. You'll see it there about in the middle, and you can type in your question into the box that appears. And if you have technical issues, you can support.zoom.us. And I'll say again, if you could turn off your camera and audio for those who join us. We want to make sure the panelists are clearly visible. So Jean-Paul Mugamuzi here on the screen, Executive Director of the Refugee and Immigrant Association and one of today's panelists, had the very good idea of bringing us together today to comment on, to discuss what's happening in these really unprecedented times, and to talk about the specific needs of refugees and immigrants in the ICR community and in the state more broadly. So I'm not generally a fan of statistics, but I do think that they give us some context and show us sort of the weight of where we are right now. The numbers are changing and are adding, but globally, the figures are these. There are over 2 million now reported cases of folks that have contracted the coronavirus, and there are over 138,000 deaths worldwide. Nationally here in the US, those numbers are 644,000 plus reported cases and just over 30,000 reported deaths. In Iowa, there are approximately 2,000 reported cases and 53 reported deaths, at least at the time that I gathered these statistics. These are certainly uncertain and serious times when public health is of the utmost concern. Our attention then must also address the impact on refugees and immigrants. So in this webinar, we have some goals. They are to discuss how the novel coronavirus is spreading in the state of Iowa, best practices to avoid becoming infected, and what to do in case of contracting the infection. Also, we're going to discuss challenges faced by refugees and immigrants in the community. We also want to share what supports exist for citizens, especially refugees and immigrants from the city of Iowa City and the surrounding area, and then more broadly around the state as well. And we also want to specifically see what supports exist from entities like the Refugee and Immigrant Association, as well as the Bureau of Refugee Services in Des Moines at DHS. We also want to answer your questions. The COVID-19 pandemic. So if you have questions, please do write those again in the chat. You'll see the chat icon at the bottom there, and you can ask your questions in the text box that appears. So I am pleased to introduce our panelists, our esteemed guests. First, I want to introduce Bruce Teague, Mayor of Iowa City. Additionally with us is Dr. Alka Walter, a family physician at UIHC, and she is co-chair of the Congolese Health Partnership. Mark Sucheska, who is joining us via audio. You won't be able to see him on the screen. Mark Sucheska is the State Refugee Coordinator at the Bureau of Refugee Services, Iowa Department of Human Services. And of course, Jean-Paul Mugemuzi, Executive Director of the Refugee and Immigrant Association. Again, for those that have joined us, if you would please turn off your camera and make sure that you are muted so that we can focus on the panelists. Thank you very much for joining us, and we look forward to hearing your questions. We do have some prepared questions, and so in an effort to be cognizant of time, we'll focus this section, these prepared questions, for about 30 minutes or so. To begin, Dr. Walter, would you please give us a description of COVID-19? And especially what I'm thinking about here is, what are the symptoms of an infected person? What are the best ways to avoid becoming infected? What should a person do if they believe they have contracted the virus? And importantly, what shouldn't they do? But maybe we can just begin with a description of COVID-19.
Thank you for inviting me to be on this panel. So I'd like to talk a little bit about the COVID-19. COVID-19 stands for corona. That's where the CO comes from. VI is the virus, and the D is disease. So the coronavirus is a part of a family of viruses that can cause illnesses, such as the common cold, and they've also got more severe illnesses like the SARS virus. And this particular disease was first identified in 2019 in Wuhan, China. And now, by March 2020, the WHO declared it as a pandemic outbreak. So the symptoms of the COVID, I'm going to refer to it as the coronavirus disease. Symptoms, the three big ones that we often talk about are fever, cough, and shortness of breath. However, there are other symptoms which we need to be aware of, and these can involve people just feeling really tired and achy, a runny nose, sore throat. Some people have more stomach symptoms like diarrhea, but also for you to be aware that there's a lot of people who've been reporting a loss of taste and smell that is really sort of, it hangs on for a while. So headache is another one. So these are symptoms to be aware of, and especially in the context of if you think you've been in contact with somebody who might have the disease or has been diagnosed, or you're in a setting where the coronavirus is around, these symptoms should be concerning. So, of course, I just do want to say coronaviruses have been causing colds and cough kind of symptoms for a while, but this particular coronavirus has symptoms which are concerning, and they're very contagious. So the next question was, what are the best ways of avoiding becoming infected? I think to preface this, we need to know that there's no treatment and there's no vaccine. So the best way is prevention. So as the CDC has put out, and how all of us in the medical community do agree, that the best way to avoid getting infected is to stay away from people. If we can stay at home, keep away from people, keep a distance between folks. What we're talking about is 6 feet. That's because the virus spreads through respiratory droplets, which can fall within a 6-foot distance from the person. Now we're also realizing that it can get carried in the air like an aerosol. So the best thing is to stay at home, stay away from people, because we don't know who's infected. There are a lot of people who may be asymptomatic, but they're carriers, and they can pass on the disease to folks who will show symptoms. The other things to remember are, of course, to wash our hands often. The 20-second rule applies. If soap and water is not available, then a hand sanitizer contains at least 60% alcohol. Covering the mouth nose while coughing, either with tissue or in the elbow, and then avoiding touching our faces, nose, and eyes because the virus can be transmitted that way. If somebody's sick, I would also suggest not to share your personal items like, glasses and food items, clothing, bedding. Um, that's one way to avoid getting sick. And then to clean surfaces which are commonly used either at a workplace or in the family, to disinfect with a household disinfectant. There are a lot of these recommendations, all important, but I think the main point is to stay at home and stay away from people, and especially if you're sick, to stay away from people because you could potentially infect other people. I do want to bring up the point about wearing a cloth mask, which is a recent recommendation. The cloth mask is what's recommended that we wear when we go out into the public. However, it doesn't really protect us from the infection. What the cloth mask is going to do is, if we are potential carriers, we prevent spreading the infection to someone who could potentially get infected. So that's kind of the idea behind wearing a cloth mask, and it is recommended. We want our community to be safe, so it's equally important to prevent the infection for other people as it is to keep ourselves safe. And especially people who are high risk, older folks, people who have chronic illnesses, and people who may be immunocompromised in any way. These folks really do need to be extra careful and prevent the infection by doing these measures that I talked about. So the next question was, what should a person do if they believe they've contracted the virus? Again, stay at home. The first step is stay at home. This is called self-quarantine, where you sort of remove yourself from mixing with people. So I'd like to say, stay at home, stay separate, and monitor your symptoms. So staying at home is self-quarantine. You take care of yourself, keep yourself well hydrated, and just monitor your symptoms. If you feel you're getting worse, then that's the time to call your medical provider. Separate yourself from others. So if you're at home, it's better to be in your own room if that's possible. If you have a separate bathroom you can use, that would even be better. Keep yourself away from the family and even from pets, that's recommended, so that you do not spread the infection to others. And the most important thing is to monitor your symptoms, check your temperature. If you feel your temperature is going up, you're feeling more short of breath, any chest pain, that's the time you do need to call. So we are recommending that people call first, because then you can get an idea as to which clinic you should go to, or whether you need to go to the emergency, or whether you need to call 911. In our area, we've got the Mercy Hospital, we've got the University Hospital, we've got phone lines. There's a special clinic where people can call, and there's always someone at the end of the line to advise you whether you need to stay at home. If your symptoms are mild, you can stay at home, and we'll give advice on how to take care of yourself at home. If it sounds like this is concerning, then you will be directed to the correct clinic or to go to the ER. So those are kind of the same steps. I'd like to just summarize. If you think you've contracted the virus, separate yourself, stay home, and then get the help you need by calling your provider or the correct clinic. The coronavirus does have an incubation period between 2 to 14 days, and that's why it's recommended this 14-day quarantine. The 14 days is from when the point you think you've contracted the virus to when your symptoms appear. So if you've been at home for 14 days and you haven't shown symptoms, then that's a good chance that you're not going to become sick. Most people just have mild symptoms, they recover, but if, like I said before, if you are feeling worse, if you're feeling sick, anything that's concerning, please do call a medical provider, and you will be directed to take the correct steps. Yeah.
So that's a wonderful explanation. Thank you. And it covers, a lot of ground, but I think gives us a really good sense for what people are experiencing and what we need to be aware of. In really specific terms, this webinar, this discussion is all about sharing as much information as possible. And one of the things that I think a lot about is, particularly when you started your description, at a time when we might otherwise be facing things like the flu or the common cold, it seems like a person could get, myself could get very confused about, I'm sick, I am feeling I'm experiencing some of the symptoms that you described. Do I have the coronavirus? I don't know. It could be this, it could be something else. Am I right in what you're saying is, if I maybe suspect, I should call, but I should err on the safe side and sort of self-quarantine for 14 days?
Absolutely, yes. Because just like when people had the flu, if they had mild symptoms, we weren't, there's no treatment for it. The best thing is to stay at home, take care of yourself if the symptoms are mild, and just keep away from people. Those 14 days are really important in you helping yourself recover and preventing you from spreading the infection to somebody else. So yes, absolutely.
And to whom should that phone call go? Should I be thinking, I think I might have the coronavirus, I should call the hospital?
So good question. If you have a prayer or a primary care physician or somebody you're familiar with who you see regularly, I would encourage you to call them and ask them what you should do, because most clinics and hospitals already have a protocol in place as to where people should go. At the university, we do have a clinic. It's called the ILI clinic, which stands for influenza-like illnesses, because there's a whole range of illnesses which might look like the coronavirus. So you will get to speak with a provider who will go through several questions to try and help figure out, either via the telephone or a video visit, and actually see you and help you decide and direct you whether you should come into the hospital immediately or give you advice on how to stay at home and take care of yourself.
And I want to encourage also, if the other panelists have questions, follow-up or clarifying questions, to please jump in at any time. I want to ask, given that we're talking about the coronavirus, but in a more particular context, Jean-Paul, I want to ask you, what are you hearing from individuals within the Refugee and Immigrant Association community? What are the questions? What are the fears and concerns that folks are registering to you? And also, how are you responding to those?
Thank you very much, Peter, for the word. And as I said, we are hearing a lot from the community as people are going through a lot of challenges. People the access to the information itself is a big issue. So people, they don't know what is going on. They don't have like the right information to the right time. And then people, they're asking themselves because they don't know what is going on. And if you can follow according to the doctor she had say. So there is a lot of things that people are questioning about when they say that there is no cure. So the only thing that you have to do your best, to wash your hands and then wear a mask if necessary, maybe gloves, and then have the hand sanitizer. But when you go to the store, you cannot get these things where you can buy them. And now people, they are trying to ask themselves, where are we going to get the hand sanitizer? How are we going to get the mask if you want to go to Walmart? Gloves, all those things. And even for people who have let me say the gloves, for example, as people, they don't know even how to use them. People, they think that when you have the gloves, so you are secure. And then you see someone wearing the gloves from his home to go to Walmart, the same gloves. So you get to the Walmart, you push the car, you buy stuff, and then you go back with the same gloves until to your place. So without knowing that the gloves can be, contaminated. So people, they are not like aware about even how they can be able to use, and even like going to the hand sanitizer. I remember I was given one bottle of hand sanitizer by a friend of mine. And then when the friend of mine gave me this hand sanitizer, he told me that, hey, this is not a lotion. So don't use it as a lotion. So it's a hand sanitizer. So at that time, I did laugh. It was like a funny thing. But at the end of the time, I find myself sometimes using like a lot. Then, just keep like a small amount. In the question, you question yourself: is this amount is going to be able to kill the virus? And then you put a lot of, hand sanitizer on your hand. Now we are asking ourselves the question: what is the consequence of putting a lot? People using this, the cleaning spray at the home, cleaning and then putting a little amount of spray on the table. And then when you get to the house, there's a very strong smell. So we don't know what is going to come out from all those things. And this is a very complicated situation for the refugee and immigrants who are communities who are living in this country. And say like right now we have like a case who the family who lost their beloved one. Now the burial is being an issue. How are we going to go to the funeral? So they did ask for 1 month and see if maybe these things will pass and see if people they can be able to go, but still we see like the month is going to pass, nothing is going to happen. Now they are asked to just, if they go to the funeral, is only 5 persons from the family and 5 persons from the funeral home are going to, to the funeral. This is crazy. The people, we don't know what is going to happen. And and when the doctor said like for people who are infected, that like stay home, and when things are getting worse, and then you can call your doctor. So when you call your doctor, what is going to happen? Are there like any medication that will be given, or they will just keep encouraging you and telling you that just stay home and then be away away from people so that you cannot contaminate? All those things that people like they're making like people do not understand what is really going to happen. And I would say that a very, very key issue is the length of the information. People, they are not getting like the information at the right time. And this is why until now, like things that people they should know maybe 2 months ago or 3 months ago, they just know right now. Like the doctor said that the mask is not something that is going to prevent you from getting the virus. But the only thing that the mask does is to prevent spreading the virus. If you are positive, so when you put your mask on, that means that you cannot spread the virus to other people. But people they know that when you get the mask on, so you are protected. All those things like this, a lot of things that should be done so that the people can get the information on the right time. Yeah.
Mm-hmm. I mean, part of what I hear you describing is sort of a real picture of there being lots of confusion and that leading to anxiety about what do I do? I mean, we've for so long, I think, regardless of sort of one's social station, have sort of taken for granted some of the practices we do on a day-to-day basis, and now we're sort of thrown into flux. And these very simple things can lead to real anxiety. Going to the grocery store, like you described, and when we, in the terrible and really unfortunate circumstance where we lose somebody to this virus, can we have a funeral for them? I mean, I get a real sense of anxiety and confusion.
Yeah. And what of that? There is other that family we still have like some members who are still working at like companies like Amana, Tyson, something like that. And when you hear that there is a higher number of people with contaminated Tyson, so people, you see someone going to work, but when the person is coming back, so you don't know what is going to happen. You know, yeah, this is crazy. And
Um,
people are asking themselves if someone gets contaminated from the work and die. So what is going to happen? The company is going to provide something we don't know. Yeah.
yeah, yeah. I wonder, Mark, what are you hearing from folks around the state, and what does your office do to support folks, especially refugees? You being at the Bureau of Refugee Services, the State of Iowa Department of Human Services. Times, what are you seeing, and what can you suggest?
Sure. Well, thank you for that question. And again, thank you for allowing me to be a part of this panel and discussion. I think it's very vital that we come together as a community, not only in our local areas, but statewide, to address some of these concerns that have been raised by our community, so we can mitigate some of those barriers and sort of fill the gaps where they do exist. What we're mostly hearing from communities statewide, and us being a state office, we do provide support and resources to refugee communities across the state of Iowa. The Bureau of Refugee Services does fall under the Iowa Department of Human Services, so our resources and supports do extend to those communities statewide. Most recently, with the release of the stimulus checks, we've had some questions around how folks will get those checks and when that money will be coming into their account if they do not have an open checking account. We have several case managers here on staff who have worked with folks one-on-one in helping them navigate that system. As you can imagine, it's very challenging. It has been, especially if folks do not have the relevant information pertinent to getting that check. And so we're working diligently to provide as many services as we can, culturally and linguistically appropriate services, to help navigate some of those concerns regarding people getting their money. We want to make sure that everybody who is entitled to those funds are getting those, is getting that money adequately and as quickly as possible. More so here locally, and in some of my conversations with resettlement partners in Cedar Rapids, a lot of our ethnic-based organizations and those agencies working on the front lines have shared concerns about their own health and a lack of access to PPE. And so where can folks get masks? As Jean-Paul was suggesting, where can people get hand sanitizer? Those are all relevant and important concerns to be addressed. We know that many members of our community who are in vulnerable states do rely on services and providers for that assistance. So how can we ensure the safety and well-being, not only for the people that we are working for, but those people who are actually doing the work for our community? So that's been a concern, and we've been trying to work with local distilleries, believe it or not, to get partnerships on providing ethyl-based alcohol sanitizer, at least at the minimum what the doctor was saying, 80% for it to be effective. I know that the Iowa Department of Human Services has established a partnership with Cedar Ridge Wine and Distillery for hand sanitizer to be delivered to our offices here, and then we appropriately disseminate through our community here in central Iowa. So those have been some of the concerns. I think Jean-Paul touched on health overall, mental health, physical health, and just concerns regarding services being provided for our community members here in central Iowa and across the state, in eastern Iowa as well, and how do people gain access to those services. It's real. It's a real thing, and I think it takes a while for people to maybe relate or understand the severity of the situation. Unfortunately, it's as late as it affecting them personally. And so how can we get the information out there and the support to our community members so we are prepared accordingly to try to at least get ahead of the situation with respect to being able to get the proper education so we can plan accordingly. I think the big thing for our office and individuals that we have been talking to is really layoffs and people losing their jobs. As we know, refugee and immigrant communities are in meatpacking, production, large plant facilities. And so with the most recent information that was released from Louisa County with the Tyson plant, a lot of folks were, the Tyson plant has closed. I presume that we will gather demographic information in the coming weeks to determine who was affected. And I presume there will be refugee and immigrant community members who were affected by the COVID-19 virus. So how are we addressing those concerns? How are we ensuring that people are getting food on the table, are getting the supports they need from a financial perspective has been a challenge for us. And so addressing all those barriers and situations that are going on, our office has continued to run business as usual with some slight adjustments as far as walk-in hours and accepting people physically into our office. We are open 8 to 4:30. As noted, we do work statewide. We are helping people navigate the unemployment journey, I guess, for lack of a better term. We are continuing assisting our refugee community members in applying for public assistance, food stamps, medical assistance, cash assistance. That is continuing to happen. We do also provide ethnic-based community organization capacity building, either workshops or direct one-on-one assistance for those ethnic-based organizations who need the support from either grant writing or just navigating this time. We have in-house experts who are willing to provide that support. And as a state refugee coordinator's office, it is our responsibility through our agreement with the Office of Refugee Resettlement to provide that support, not only for our ethnic-based organizations here in Central Iowa, but across the state. As noted earlier, we do provide culturally and linguistically appropriate resources in partnership with the Refugee Alliance of Central Iowa and several other entities here. We have established a statewide hotline that individuals can call to get culturally and linguistically appropriate information in their respective language. I'm going to share a blurb from our newsletter in the chat box, and so I will copy paste this information for you real quick and put it in there for you so you guys can take a look. The number is in there, as well as who the partners are in working on this hotline. It is 24/7. If we do not get to you, feel free to leave a voicemail, and then somebody will get back to you with the pertinent information. So the hotline is in many different languages. The number is there. Feel free to contact that number for guidance and just assistance in navigating resources statewide. Also, we do have resources here in our office, from CDC translated documents to documents from the World Health Organization. As noted earlier, our State Refugee Coordinator's Office is in partnership with ORR as well as the CDC. So we are consistently getting translated documents in respective refugee and immigrant languages. I would be more than happy to share that with this network. As noted, it's very important for our members to get the correct and accurate information during this time. Interesting story about that. Jean-Paul's point reminded me that of the misinformation that's going on in our community. There was the Burmese community here locally in Des Moines, for some reason, was receiving emails community-wide stating that the National Guard would be mobilizing and they would be spraying pesticides and different sort of sanitizers throughout the communities. There was a lot of fear around that. Fortunately, that wasn't the case. That was just a phishing email, I think, that went out throughout the community. So those are those kinds of barriers and issues that we have to ensure are getting mitigated and addressed, because the spreading of that misinformation not only will lead to inaction, improper action, but also fear, community fear in general. So we're trying to work with our community partners to mitigate some of those issues. As noted, as sort of alluding to the partnerships, we are partnering with coalitions statewide as well. Iowa City Compassion, Jean-Paul, we'd be more than happy to work with the Refugee Immigrant Association in Eastern Iowa. We have local partners throughout the state where we're just continually connecting, sharing resources, information, whatever we can do to come together to address some of these concerns and to establish a strong coalition to help our most vulnerable. This is the time to do it. And I think what I will end on is that our office really provides a sense of perspective. I myself come from a refugee community, was originally resettled to the state of Iowa from Bosnia in 1993, and the majority of the staff here at our office are refugees. And so when all of this started happening and when we were moving to folks working from home, there were several memories that were raised, that were brought up actually by our refugee staff members about how all of this is all too familiar with lockdowns, lack of access to communication, people having to stay in their homes, different schedules and curfews. So this PTSD really arose. But on the flip side, it's built sort of an understanding that people have been through things like this before. And so for communities that aren't used to this, I would definitely rely on your refugee community members, talk to them, try to get an idea of what it's like to really go through something like this, especially for people who haven't been accustomed to that and it's completely new. Fortunately, we do live in a time of technology and technological advancements where we can Zoom, we can talk to one another. We live in an infrastructure where that is available. Many people, on top of the refugee experience and a lack of having resources, are going through much dire situations during this time. And so I think it's important to keep things in perspective as we go forward and to maintain the humanity in all of this, that at the end of the day, we're in this together.
Thank you so much, Mug. That particularly your last point there about perspective, I think is really important. And I can only imagine, knowing Jean-Paul as well as I do, that you bring that same perspective, and this is exactly why you wanted to have such a forum for this conversation. And Mark, you're doing so much there. It sounds like you're extremely busy. Mayor T, I imagine the same is true for you and your colleagues at the city. I'm wondering what has been the city of Iowa City's response to the pandemic, and really what should people in the community know about how Iowa City and maybe you know of others, particularly in our region here, about how you all are handling this crisis. I think a lot about how, one of the things Mock pointed out is that there's all sorts of different information coming our way. And in 2020, probably too much information in so many different ways. I know I hear different things coming from the federal level, different things coming from the state level, from the local level. And maybe it's really important now for us to know, particularly those of us that live in this area, you as mayor can really shed a lot of light about how you all are seeing this pandemic here in the area, and what your response has been to it.
I'll tell you that this has been a very challenging time for all of us as we're navigating this pandemic, and it's very new to our community in our lifetime. What I will say is critically important that people do find credible resources, credible information. And one thing that I've been doing, because there's so much happening with this pandemic, the information that is being released is changing on almost a daily basis. We're seeing the governors doing new proclamations. Like today, she stated for the northeast northeast region of Iowa, which includes Lynn County, almost all gatherings outside of the immediate family has to be halted, and except for some religious services and funerals. And of course, those still have to be under the 10. So we're getting information that really relates to Cedar Rapids or to that part of the region. But I will urge people to even take hold of some of those things that are happening here, and as well as in other regions in our state. When it comes to the safety, there are things that you can do. We don't actually need a shelter in place order to do those shelter in place things. And so we've been working very hard, and I can get into the nitty gritty of what the city has been doing and myself has been doing nonstop. This morning, I think my first call was about 6:30 this morning. That's kind of late. It's been having about 5:25 or so in the morning. But I can tell you that we are having endless conversations to try to figure out what all we can do to keep our community safe. Many of you may have seen a new program that I started. It's the Community Connections with Mayor T. And this is an opportunity where on Facebook and other media outlets, I am bringing on guests. And I can tell you that right now I see some future guests because you all are awesome and amazing speakers, and you have a wealth of information that you're sharing here. But I've been bringing on guests to kind of share information with the community, just what they're doing. For instance, the school district. I brought on Superintendent Murley. I brought the community crisis services to come on and talk about the services that they're doing in this pandemic. They're still giving out food, and they're also delivering food to people that need it. So United Way was a guest. And then on Monday, next week, I'm going to be bringing on the Johnson County Public Health Director so that he can kind of talk firsthand with people what's happening. So the message that I want to give to people is that from a political position that I'm in and an elected position that I'm in, we have to balance civil liberties with some of these recommendations or even orders. I would love to be able to tell people to, when you go to the grocery store, do this, do this, do this, do this. Teach them how to wear their gloves. I still believe that there's opportunity, as John Paul has talked about, to demonstrate how people can effectively navigate some of the basic things that we're talking about. We're asking people to wear masks, and they may be doing it, but do they really know how to put on how to operate with the mask? We're asking them to wear gloves when in grocery stores. But if you leave your house with your gloves on and you go all the way to the grocery store and come all the way back, and you stopped at the gas station and pumped the gas, there's a challenge with what you're doing. And so what I would tell people, reach out to credible sources that can help navigate real life information to help you be successful in navigating through this coronavirus. I appreciate the opportunity of being here today.
Thank you, Mr. Mayor. I like that a lot. I mean, we really do need to know what's happening, what kinds of decisions are being made, and what philosophy is being used to make those decisions. It's really crucial. Thank you so much for being on the webinar today. One thing I want to touch on real quick, Mock mentioned the hotline, and one of the things I've been thinking about a lot, especially relative to refugees and immigrants, is the question of language. And I'm appreciative that there are multiple languages I see listed here. And the number being 1-877-558-2609. I wanted to actually verbalize that here in the middle of the program. I wonder, Dr. Walter, I mean, you're a practicing family physician, so would you tell us a little bit about what you're seeing when folks come to you? What do these cases look like? And what are those patients expressing to you about how they're handling everything?
Yeah, so first of all, can you hear me? Yeah.
Yeah.
So when somebody calls in to the hospital, to the university hospital, what happens is if they have symptoms like what we had talked about before, a cough, fever, sore throat, shortness of breath, um, folks are directed towards a telephone visit with a provider who goes through several questions to try and assess. This is a little bit in response to what John Paul was asking about, like what happens after this. So people are assessed. If it sounds like they might have the COVID virus and they need testing, they are directed to come into the clinic and get tested for the virus. However, if it sounds like they don't meet the criteria for testing, so as you all are aware, there aren't enough testing kits available. So we're being pretty specific in who gets tested. So it's people who are older, people who have chronic illnesses, first responders like healthcare providers, police officers, people, EMT people, people who work in large congregated areas, as you all are aware, people from the Tyson West Liberty meets, folks who are working there are getting tested. So if people meet criteria for testing, they get tested. If they are positive and they are not very sick, that means they have mild symptoms, they are encouraged to stay at home. But we have a really robust system in place, and this has all come about recently. There is a whole team, it's called a hospitalist team, who follows patients at home. So patients are given a blood pressure monitor, a device to check their oxygen in their blood, and are sent home and are called every day to check on their symptoms. So if it sounds like someone's not doing well at home, then there's an appointment made and people are brought into the hospital. Suppose they're just dehydrated, we have a plan where there's a clinic where people can receive IV fluids, get rehydrated, and then go home if they are well enough to go home. If people are in need of oxygen, they're having shortness of breath, they need more help, there's a whole unit who takes care of them in the hospital. And there are people who don't meet testing criteria, but it might be really likely that they have the COVID virus. There's again a plan where someone calls them every couple of days to check in on how they're doing, monitor their symptoms, educate people as to what they should be looking for. So I have heard from a couple of people about how, you know, we call and we feel we've got the virus and nobody's testing us. People just tell us to go home and stay at home. So most people do have a very mild disease and can stay at home, but we do have a way to monitor people to make sure they're doing well at home. So as you were saying, what's happening in the hospital? Well, medicine is changing so much. I mean, we are trying to keep people safe by not letting them come into the hospital, but we're providing care through different ways. So one thing is our number of telephone visits has really gone up. So people who might have had a clinic visit, we've switched it to a telephone call. So providers will call patients and have a visit on the phone. If people have the ability to have a video visit, even better. Then we can actually see people. We can ask them to do kind of a physical exam while watching them. If people have a blood pressure monitor, we encourage people to use those things. So things, as Mayor Teague said, also things are just changing every day. We get guidelines almost every 12 hours, there's something new. So the message I want to get across is that I know it's frustrating for people who are worried, who are scared, like what's going on in the hospital, but we're also, this is all new to us. We're trying to do the best we can to make sure people stay safe, but yet receive the care they need.
Mm-hmm.
Yeah. I also just want to quickly, two more things I was really keen to talk about was about medicine. Like there's a lot of talk about, are there any medicines that are coming out? And as of now, there isn't any definite medicine which can treat the coronavirus disease. However, the university is involved with 2 new medicine trials, but that's all still in a trial basis. People can, if people are COVID positive and they have symptoms, they can enroll in those studies. So again, prevention really is the way to go. And another question which keeps coming up where there's a lot of discussion in the medical community is, how do we know people really have recovered from the virus? And do they really have immunity? I mean, are they safe to go out into the world and not be in isolation? So the tests which we have to say that someone is negative are available, but they're not the best right now. We can pick up antibodies, but we don't know whether people really have good immunity to protect themselves from the virus. And it looks like this immunity may last just about for a year. So there's still a lot of research that needs to be done, questions that need to be answered, and for the medical community to learn from our mistakes or trials of what worked and what didn't work. So things are still changing.
Yeah, things are definitely changing very quickly. And I think looking at the questions that have been asked thus far, I think you've addressed them. One was vaccines, but I think sort of borders on possible treatments, which you just touched on there. I wonder, sort of, and folks can still ask questions. There's still time to get those in. I wonder if we couldn't do a sort of quick round robin, if you might share a bit of practical information, maybe something, or ideally something we haven't discussed already, a bit of practical advice that we can share with those who are and who will watch this video, this recording, specifically those who are refugees and immigrants. What can we practically tell people in a time when things are so uncertain, when there's so much information, and when it's hard to discern between credible and non-credible sources? Maybe Mayor Teague, can I start with you? Nuggets of really practical advice that you can offer, how to help folks, refugees and immigrants, stay safe right now.
Yeah, so when we listen to the numbers of the coronavirus in our community, right now we have 1,884 and 3 deaths to date. Those are scary, and we don't have control over those numbers, but we do have control over our actions. And so that's the practical thing that I would say, is that it is very unfortunate, the things that are happening, but we do have some control. And the things that we have control over are our actions. We are in this together. We can do this together. And what you do affects me, and what I do affects you. Please wear your mask, wear your gloves if you have them. Be very conscientious of your interactions and making sure that you're staying 6 feet apart. And regardless of a shelter-in-place order or a stay-at-home order, there are things that you can honestly do to make sure that you're doing all the necessary things to keep you and subsequently me and everyone else safe. So that's the practical information that I would offer.
Thank you. Yeah. Ma, from your vantage point.
I like what Mayor Teague said. I think I would piggyback off of that and say, during this crisis and during this time, people can get help. People aren't alone, and there are resources and agencies out there who are ready, have been, and willing to support refugee and immigrant communities. I think the most important thing to note from a societal perspective is that we've clearly seen this virus does not discriminate, whether you are a refugee, immigrant, non-native speaking member of our English speaker of our community, born in Iowa, race, ethnicity, creed, background, it doesn't matter. And so to the mayor's point, and I think the underlying theme that's been going on overall is that we are in this together, and those who are most vulnerable in our communities do have the supports they need. It's on us who provide those supports and who are in positions of power and privilege to adequately and appropriately disseminate that information to our communities by working together, gathering what is needed, and finding ways to strategically get everything out to those people who need the support. I think reiterating that is most important. And yeah, I guess I'll leave it at that.
Thank you, Mark. Jean-Paul, how about you? What practical advice right now would you offer to those folks in your community who look to you for leadership and advice?
The advice is just like as the mayor said, just people to stay home and then to be, to follow all the instruction given. Yeah, I would just like to add something about what we are doing. So we've seen that there is a lack of information in our community. So we came up with a project of, to gather all the information and then put those information in different languages. And then have it like a newspaper, then we are going to do a drop off to different houses and then community leaders so that we can make sure that our community are getting informed. We are doing. And then if anyone among the panelists, we have like any new information, so you can try to add it, then we can see how we can be able to share that information with the community.
Mm-hmm. Yeah, that's really great. Yeah, and I mean that's definitely a theme here. That information really matters, and getting the right information, getting credible information, and really taking it all to heart because we are in such serious times is so crucial. Dr. Walter, how about you? Practical advice to give to folks right now? Maybe something new that we haven't already discussed.
Yeah, I think the two main things, it's a little bit what we've talked about. One is because there's a lot of folks who don't speak English, navigating the medical system is just scary. I mean, It was scary for me when I first moved here. I speak English, I'm a doctor, but just understanding the system of insurance and medicine and how things work is scary. So first thing is, I just want to encourage everyone not to be scared to ask questions. So I've put in the number for the hospital there where people can call in. That's 319-384-9010. And don't be afraid to ask for an interpreter. We can get interpreters in whatever language you would like to speak in. So don't feel afraid to ask for help, get the help, and in a language that is appropriate for you. That's the first thing. And the second thing is to get information, as Mayor said, and a lot of the other panelists said, is to get credible information. There's stuff on Facebook that's scary, that's not true. So look for information from credible sites. And I just wanted to mention that the CDC website's a great place for good, sound information. I know the Embark Association has been translating a lot of the governor's messages into various languages, so people can go to their website and listen to what the governor is saying in the various languages. We at the Congolese Health Partnership have come out with a series of videos in French, Lingala, Swahili, and now Arabic, Kinyarwanda, I don't know, Spanish as well, where we just talk about protecting ourselves from the COVID virus. So those are YouTube videos which are available.
Those are great, by the way.
Thank you. Yeah,
videos are awesome. I've been sharing that with everybody. So thank you for the efforts in putting those together.
Thank you for that feedback. And we're also hoping to get like frequently asked questions, which people want answers to, and we'll try and do a forum where we can answer questions. So that would be my advice. Just get the correct information and don't feel afraid to ask for help.
Yeah, thank you very much. The idea of sort of collecting the questions that matter to people, I think is really important. And I don't know if there's a way to centralize that, or for agencies, cities to be collecting that and put in a place where it can be shared. I mean, so much in this time, people have questions, and it's really hard to find those answers. Oftentimes we don't know who to go to answer those questions. And it's so crucial. Thank you, all of you. I want to really emphasize that you've taken time and an effort to be here today and to share, again, this credible information and to share it with folks who really do need this information. I want to thank those who have participated today, who have asked questions, and I encourage others when you watch this recording later that you do ask your questions, because we do need to ask them. Otherwise, I think we get sort of overwhelmed by the confusion and the anxiety that exists around us in these times. We can see here that all of our panelists have really sort of echoed some similar themes, that the help is out there, and that as much as sometimes I feel like they're on their own and they're really struggling, that we are in this together. Those are really important messages. We will share this recording and have it very soon. Please do let Jean-Paul Mugemuzi at the Refugee and Immigrant Association know if you would like this link. I'll certainly share it with the panelists so that they can have it too, so we can distribute it as far as possible. I finally want to say to all of you and to all who might watch this to please stay safe, stay healthy, and do take care. Again, thank you, everybody.
Thank you.
Thank you so much.
Wash your hands.
Thank you.
Thanks.
Bye, everybody.
Bye.
Bye. Thank you.